child with color blindness.
Yeah.
How does that
Yeah, it's a really good question. So if you look at visual stress and you say, do people with a colour vision defect have more visual stress or less visual stress? What we found in research is it doesn't seem to be related.
No, but do the different colours affect them? Is that the same way?
They still find a colour that helps. There will probably be, we've not seen enough to research it properly, but you would expect them to be less specific about the colour they need, because obviously they've got less colour discrimination.
So do you have patients, children that are colourblind, and most of them you give or you don't give? Or?
Same as children who aren't colourblind. So again, about 1 in 5 dyslexics need colour filters, I think, and about 1 in 5 dyslexics who have a colour vision defect seem to need colour filters too. Now we're going to talk tomorrow afternoon about why coloured filters help. Before you prescribe coloured sheets or coloured lenses, coloured overlays or coloured lenses, you would first, of course, make sure there's no binocular vision or accommodative problem. But you also want to see if there's a sign of visual stress. And the mechanism why we think these coloured filters help some children is because of an overloading of the visual part of the brain. And we're going to go through the evidence a lot more for that. But if you get epilepsy or migraine, don't look at the slide now or look at it through one eye, because this sort of pattern for people with epilepsy can trigger a fit. No one here, that's good. For people with migraine, if they look at this sort of pattern for long, it can cause discomfort. I get migraine, it's why I can't arm striped shirts. That's my excuse and I'm sticking to it. My wife doesn't believe it, but anyway. But if you look at this pattern, for those of you who can, when you look at this pattern, do any of you experience distortions? Do any of you see it appearing to blur and move?
Yeah.
Okay. You have got the symptoms of visual stress. Now you might not get those symptoms with text because it's on a continuum, and only people with severe visual stress get those symptoms with text. But this sort of pattern is very strong. It's at the peak of our contrast sensitivity function. And because this 4 cycle per degree stripe pattern is at the peak of our contrast sensitivity function, it will overload the visual system for some people. And this is, if you like, a new concept for us as optometrists, because we're used to dealing with people whose visual system is in some way lacking, whose visual system is lacking sensitivity. Maybe they've got low vision, maybe they're old and they've got cataracts, and so their contrast sensitivity is reduced. What we're talking about when we talk about visual stress is the opposite. We're talking about people whose visual system is too easily overloaded. And what is the stripe pattern that we look at most often? The stripe pattern we look at most often is text. If you defocus text to look at its spatial frequency properties, you do a Fourier analysis of text, you find that it forms, the lines of text form a stripe pattern of about 4 cycles per degree. A research going back in the 1980s when they got people with migraine who were finding reading uncomfortable, and they said to them, bring a book into our research lab that you find comfortable to read and a book that you find uncomfortable to read. And they did this sort of analysis, and they found that the books that people found uncomfortable to read were those where the lines and the words were spaced in a way that had this 4 cycle per degree strength, if you like, a strong signal. The books they found comfortable to read were the books where the spacing of the lines was wider and they found it much easier. So pattern glare is believed to be the underlying mechanism behind visual stress. We believe that it is a hyper-excitability of the visual cortex. Who has pattern glare? Possibly people with reading difficulties, although that's debatable. definitely people with migraine. There's a lot of research on this pattern glare, this sensitivity to stripe patterns, showing that people with migraine usually have it. People with photosensitive epilepsy often have sensitivity to patterns, and people with autism as well. And these are the main conditions where coloured filters can make a difference. So we're probably looking at a spectrum of hypersensitivity. If you've got acute hypersensitivity of the visual cortex, then flashing lights or stripe patterns like the one I showed you could trigger epilepsy. If you are less severely affected, then stripe patterns or flashing lights can trigger migraine. I can get migraines triggered by light flashing through trees or a lot of stripe patterns. And the people with reading difficulties, the 1 in 5 people with reading difficulties who have visual stress, those we think are the people who have a more subtle form of hyperexcitability of the visual cortex. So we developed a pattern glare test, and the pattern glare test is the final test that you'll be, almost the final test you'll be using in the workshop later. It's a simple booklet, and it's a booklet with 3 gratings. Here's the first grating, which is a very low spatial frequency that is a control condition. Because you measure pattern glare simply by, here's the grating that should cause pattern glare, and you measure pattern glare simply by having the person look at the grating and you ask them what they perceive. You ask them a list of questions about any distortions they get. And those questions are, when you look at that pattern, do you see colours? Do you see bending of the lines, yes or no? Do you see blurring of the lines? Do you see shimmering or flickering? Do you see fading? Do you see shadowy shapes? That is it. That is simply how you measure pattern glare. You ask them about those questions, and if they say yes, they get a score of 1. If they say no, they get a score of 0, and you add up the number of yeses, the number of 1s. So, if I pass that round...
You can find out that they have AMD.
You can find out they have...
AMD.
AMD, yeah. It's not quite the same as an AMD test, but yeah, I know what you mean. The problem with the test, of course, is if you ask a child, do you get colours when you look at it? Some children will just say yes, because they're suggestible. So that's why we have this grating. People with real pattern glare, with visual stress, won't see distortions, or not many, with this grating. So this is a control grating to control for suggestibility.
Is it a different pattern?
Yeah, because it's very coarse, it's of a spatial frequency that should not cause pattern glare. So it's a control for suggestibility. This is the grating that should cause pattern glare. If they get lots of symptoms with this one, and very few with this one, then they have pattern glare. If they get lots of symptoms with this one, and with this one, they're probably just saying yes to whatever you ask them.
But it's not exactly, because this is much more crowded, so they'll feel something different. They'll feel like they want to say yes here more than before.
Yeah, it's true, but the symptoms usually will be helpful. It's not a perfect test, but yeah. There's also a third grating, which I won't go into today because we don't tend to use that very often. And so we did some research with this test, and this was research I did with Sarah Stevenson, and we came up with norms for the test. And we looked for any gender effects, age effects, and we looked at patients with migraine. There were 100 patients seen in an optometric practice, all of them aged over 10, all of them with reasonable VA, and they were age randomised. So what we showed was, this is the number of symptoms. So when we asked them that list of questions, we added up the number of yeses, and for the coarse grating, most of them had no symptoms, and some had 1, some 2, very few with more than 2. With the nasty grating, then you can see that it was more evenly spread out. Still, quite a few people had no symptoms, but some had 1, 2, and some had 3 than on the other grating. We looked for a gender effect, and when we looked for a gender effect, there was no effect of gender, so males and females were similar. We looked for an effect of age. Now the cortical hyperexcitability model, you would expect the cortical hyperexcitability to reduce with age because the visual cortex is becoming less sensitive. And that's exactly what we found. We found that as they became older, the amount of visual stress gradually reduced. And this ties up with what you find if you prescribe coloured lenses to people with visual stress. Usually, as the child gets older, the colour they need gradually gets a bit lighter. We looked at a group of migraine sufferers and we compared them with control patients. And what we found was that the migraine sufferers over here, on this nasty rating, they had significantly more pattern glare than the control group. So again, it is, and lots of other people have found this, that people with migraine get a lot more pattern glare. We found a significant degree of pattern glare in 17% of people with migraine compared with 2% of the controls. So we came up with norms for the test, and we showed that pattern glare decreases with age and it's higher than usual in migraine, and there's an order effect that we notice as well. So these are the 3 tests that we're going to be using in the workshop later. The other thing that I should mention is modifying the environment, because you can do a lot for people with visual stress without prescribing any coloured filters for them at all. So what we're arguing is that the reality here is that only a minority of dyslexics need glasses, very few need eye exercises. And many children who choose coloured filters, as you've already realised, do so for reasons of placebo effect. So we need to try and be confident, if we are going to prescribe coloured filters, that we're giving them to people who genuinely need them, not people for placebo reasons. So recently we published this paper in 2016, no, it was published in 2017 actually, it came out. And this is a Delphi study that we did to ask people in the UK who are prescribing coloured lenses for visual stress, what are the criteria that they find most useful? And from this, there are certain symptoms that need to be present, and people prescribe coloured glasses only when there's 2 of these 3 signs. And the 3 signs are voluntary use of a coloured overlay for at least 3 months. So we dispense them with an overlay if they say the overlay helps, and they come back to us for coloured glasses if they keep using it voluntarily without being reminded. We look at the effect of the overlay on their reading performance, and if that is improved by 15%, then we take them seriously. And the pattern glare test is the 3rd sign, if you like, of visual stress. And if they have the classic symptoms and at least 2 of these 3 signs, then they would meet our criteria for prescribing coloured glasses. Now, a lot of what we're going to be talking about tomorrow is going to be about things like binocular vision and accommodation and saccadic function and pursuit eye movements as well. And I'm going to argue that we need to be careful as optometrists not to over-treat these children. And what we've done here with visual stress is we've tried to come up with a set of criteria to avoid over-treating. And when you look at optometry, I think we need to do that in the other things that we do as well. I think there's a tendency, particularly in America, to over-treat eye movements, to over-treat even convergence in some cases.
It's better to overtreat than to undertreat.
It's better to get it right. It's better to get it right. I mean, when you think about it, parents have a limited amount of resources. The child has a limited amount of time. And vision therapy is not nice. You know, vision therapy is an extra chore. Children would rather be playing. It's good for their myopia for them to be outdoors playing, not having vision therapy. So we don't really want to be over-treating, I don't think. I agree with you, there are more cases that require treatment and aren't getting it, than are getting it who shouldn't be getting it. But both things deserve attention, I think.
The whole light, the whole, it's depending also on the light that's in the room.
Yep.
Is there any reference?
Yeah, it is a factor. It's not an overwhelming factor, but it is something that you can change. And that's what we're going to, bless you, that's what we're going to be talking about a bit now. But just want to say, this is a chart that's trying to explain why people might choose a coloured filter. Because we've talked a bit about this, but when we're doing the testing later, we need to bear in mind the other reasons. And this is the problem with teachers testing for colour. They won't realise that some children might choose a colour because they have an uncorrected refractive error. So a bit like a duochrome effect. They might choose colour because they have poor accommodation, poor binocular vision. They may just be choosing their favourite colour. And these are the sort of things that we need to be looking out for. We did a study published in 2016 looking at whether boys choose blue colours more and girls choose pink colours more. And there's a slight effect for that with the coloured lenses, as you'd probably expect. But with coloured overlays, surprisingly, there wasn't a significant effect. It's very surprising. But it's something we need to think about, certainly when we're doing the testing. But the other thing that's very relevant nowadays is digital devices. Now, someone mentioned room lighting. You can buy now light bulbs that you can put in a child's bedroom where they're doing their homework, where they can change the colour of the background in their bedroom. And that may be helpful for some children. Also, though, if they're using iPads or iPhones, there's a very easy way of testing for the effect of coloured filters. And if they're doing their homework on an iPad or an iPhone, then you can go into the settings on the phone and adjust that. And if they're using an Android device or a Windows device, there's software that you can get that will let you treat visual stress without them having to use coloured filters. And for some children, that will be a lot more acceptable. So and this is something you can have a look at later on if you want, but if you go in the iDevice, if you go into settings, and you go into accessibility, and you go into display accommodations and coloured filters, you can then do an overlay test. And this is standard Apple settings. You can change the depth of colour, change the saturation, and you can change the hue to any colour they see. And this is a standard Apple setting that any child can use to test for the effect of coloured filters. I think this is liberating. I really do. I think it's great that Apple have included this in the operating system so that children can investigate. And once you set the colour, then if you come out of that and you go into a document I was reading earlier, that document will be coloured in the same way.
So
Every iPad after iOS 10. And that's something, again, in the workshop. If you're not familiar with that, I can show you how to do that. But many children are using these e-reader devices like the Kindle. And many dyslexic children report that the Kindle reader helps them. And the reason they find the Kindle helpful is probably because the original Kindle, with the LCD screen, it is black writing on a grey background. So this will reduce the signal going to the visual cortex. It will reduce the effect of visual stress. But you asked about lighting levels in schools, and research has shown that in the UK at any rate, they are too high. In many schools the lighting levels are wrong. They often have flickering fluorescent lights that shouldn't be used. Many of them have, like you've got here, worktops that are quite reflective, which for some children can cause glare problems. We need to think as well about the font. If you're thinking about visual stress, then visual stress will be much worse with some fonts than with others. And research has shown that this is the conventional view, and we now know a lot of this is wrong. People used to say that 9 to 12 point is ideal, and yet research has shown this is font style, so this is the writing with Arial, which is quite a pleasant font to look at. Here's another font, just a font that I found in Windows, one of the default fonts. You can see how this causes pattern glare to a large degree, and this one to a much milder degree. So just by changing the font, it makes a big difference. And need a lot more work looking at different languages. This is a font that's often recommended for dyslexics, Comic Sans, which is quite a pleasant font to look at. Verdana is a particularly good one for avoiding visual stress, for avoiding pattern glare. You could cover up the lines. So if a person's got a problem from visual stress, if you just put some paper, oh, that wouldn't work. But if you just cover up above and below the lines they're looking at, that will be helpful. And early research by Wilkins in the 1980s showed that if you space the lines out more, that's helpful. Now, if you say that to publishers, that we need to have a bigger gap between the lines, the publisher will say, but I can't afford to use more paper. But if you say this to them, that if you reduce the spacing between the letters, it doesn't make it much worse. But if you do that so that you can increase the spacing between the lines, the overall effect will be beneficial. So if they're worried about having the same number of pages in their book, you should tell publishers, space the lines out more, because that reduces pattern glare. So there's been some research now on children and children with reading problems, and what it's shown is that the books that we give children to read tend to have text that's too small. It's better for them if you have text that's larger. So children aged 5 to 7 read larger with text for children in the year below. Children aged 8 to 11 were less affected by text size. And Hughes and Wilkins showed that increasing the text size and spacing helps many children, and it doesn't make it worse for any children. And research by Legg. Legg's the leading researcher on reading and fonts, and Legg's team have shown that dyslexic children require print sizes that are a third larger than controls for maximum reading speed. So if in doubt, use larger fonts, use widely spaced lines, avoid bright white paper. And this is where you can go a bit green, because often recycled paper is a lower contrast. When you get white paper, the manufacturers of white paper put whiteners in it. It's a bit like washing powder for clothes. You know, they often put agents in it that make white seem brighter. And they do the same in paper. They put fluorescent agents in it so that it looks really white. And that makes it worse for people with visual stress. So if you can use grey paper or recycled paper, that will be better than white. If you're using computers, avoid strong contrasts. Teachers often say, okay, I know some children have visual stress, so I want to print everything I give the children in my classroom on colour. What colour should I use? And you can't answer it, because the thing about visual stress, as you saw when I asked you, is that the colour that helps one person will make it worse for someone else in that classroom. So they can't use one colour for all children. So what you have to advise them, if they do want to help their children, is simply to reduce the contrast, to use a grey or recycled paper. If you want to get the best colour for a child with reading problems who has visual stress, then you need to test them with the coloured overlays or coloured lenses. We'll talk tomorrow about the mechanism underlying visual stress, this hyperexcitability of the visual cortex. Now, colour is a manipulation that reduces that hyperexcitability, but it won't eliminate it. And people with visual stress, often you find a colour...
After 2 hours it stops.
Oh, okay. Often you find a colour that is helpful but is not perfect. Okay. And so you need to advise people in this case, if the colour's not fully alleviated, then there are other things that they can do, like changing the ambient lighting as well. Okay. That's okay. The rest I'm showing you again tomorrow anyway. So.
Excuse me?
Yep.
If a kid like the blue color, should I put a blue light in his room?
That would probably be helpful. Yeah. Yeah. But the
So just so you know,
Yeah.
it shuts off automatically after a
Yeah.
couple of hours.
Okay.
So you need to just click on.
Okay. Thanks.
Just click on whenever you remember. Click on power on, and then
Okay.
it'll never shut down on you.
Thanks. Okay. So yeah. So getting started on this, what you need to do, I think, in your practices when you go back after this course, is start asking your children about the symptoms of visual stress. Ask children that you see whether they see words starting off clear and then blurring or moving or merging or jumbling. If they do check the things you already check, like BV and accommodation, but also look for visual stress as well. And if they find these symptoms and they seem to be helped by colour, then you can prescribe coloured overlays. There are various companies that make these coloured overlays. You don't have to buy the ones that I'll be showing you. There are lots that you can buy. They're very cheap to buy on the internet, and it's something where I would say add this to your scope of practice. So what we're going to do in the workshop, goal of the workshop, is the first workshop we've got, there'll be no patients. There'll be these tests that I've shown you, and you'll be working, I suggest, in 2s or 3s, do you think?
Yeah.
And I would ask you please to test each other with these 3 things: the pattern glare test, the intuitive overlays, and the rate of reading test. And try, if you've got an iPhone, look at where the settings are to adjust that. And then when we get the patients, then again if we work in pairs or 3s and we carry out these tests on the patients. How many patients have we got? What are we expecting?
So how many are registered, or how many do I believe will come?
Yeah, the latter.
Okay, so hopefully we'll have at least 5 patients that actually come.
Right.
There's about twice as many that are registered.
Sounds about right. Yeah. Okay, that'd be great then, because that would mean you can work in 2s or 3s with each patient. Now, I said 1 in 5 dyslexics have these problems, so you will probably find they're normal. But there may be 1 or 2 of those children or students you'll be looking at who have got some signs of visual stress, and then we can look at them in more detail. Okay, I think that's all I had to say. Yep, and then there's only 1 intuitive colorimeter. If we've got anyone we want to test with that, I can demonstrate that to you.
I think in any case we should demonstrate it to them, especially now when we have that workshop without the patients.
Okay.
It's a good opportunity for them to get their hands on it and see how it works. אז הסדנה הראשונה שתתקיים מיד אחרי ההפסקה היא אחד על השני, רק שתכירו את האביזרים, תדעו מה לעשות. אחרי זה יגיעו פציינטים, והרעיון הוא שאתם כבר יודעים מה לעשות, כי הרגע עשיתם את זה, תעשו את זה עם הפציינטים. סבבה? כן. אוקיי, אז ניקח הפסקה, היינו אמורים להתחיל ב-1:30? אז אין בעיה שנתחיל ב-35, אבל אל תיקחו יותר מ10 דקות, כי אני לא רוצה שיגיעו פציינטים ואף אחד מכם לא למד איך להשתמש באביזרים וזה יהיה קצת לא נעים. סבבה?